Now, welcome back to Morning Live. New data from the World Health Organization reveals that the COVID-19 pandemic has disrupted the global malaria death rate, leading to an increase since 2000. Now, the report also mentions that a child now dies from malaria every 1 minute on the African continent, compared to every 2 minutes as previously reported before the pandemic. Now, Sherwin Charles is the co-founder of Goodbye Malaria, and he joins us this morning to share more about these findings. Sherwin, thank you so much for your time. Welcome to Morning Live.
Thank you so much, Sakina, for having me on.
Sherwin, one of the things that we have been saying, and it's not just malaria, it's so many other, not just diseases, but in general, so many things have been placed on the back burner as the world tries to contend and, get on top of this COVID-19 pandemic. So let's talk about the impact that this has had on the fight against malaria.
Absolutely. The pandemic certainly has hindered both research as well as supply interventions in 2020. Our health systems have been under immense pressure. We've struggled to cope with the disruption of global supply chains. And the result of all of this has seen a 12% increase in the number of cases, as well as for the first time since 2000, an increase in the number of deaths. I mean, one child lost to malaria is too many. And now we've seen over 627,000 deaths in 2020 from malaria. The increase is predominantly the impact of COVID in 2020.
So the spike in deaths and speaking to that one child every minute, that seems something that we should be alarmed about as well, as much as we are about COVID. So in terms of just raising awareness about this and what's going on, Sherwin, how has COVID once again impacted your mission in that regard?
We certainly had to adapt to the COVID environment, particularly in the interventions that we carry out in Mozambique and in South Africa. We were limited to travel, borders were closed, interprovincial travel was stopped in countries, and therefore the impact on the program, firstly, was increased costs. Secondly, was the impact on training of staff, and we have over 3,000 staff that need to be trained on an annual basis. And so we had to change how we operate within the COVID regulations. Of course, also of importance to us is that our teams visit homes door to door, and therefore we had to ensure that our people were protected. More importantly, they protected people within the communities, and we were not super spreaders of COVID. So thanks to increased funding from the Global Fund, it allowed us to change and ensure that we could train everybody within their communities, and innovation of training systems allowed us to do that, as well as the funding helped us ensure that our staff had the correct PPE and timeously so.
Sherwin, with regard to children especially, and children under the age of 5 who seem to be most affected, let's talk about that and why is this the case?
Malaria, Sakina, really has the biggest impact on the children under 5. It's a disease that, if not treated, a child can pass away within 48 hours compared to most other diseases. So really has a big impact on the children. The parasite tends to multiply very quickly, and a child suffers serious malaria in a short space of time, driven by high temperatures. I want to just highlight just the impact and the scale of loss from malaria. We're talking about a child passing every minute. That means we've had nearly 500,000 children in Sub-Saharan Africa that has passed from malaria. Just to put it into context, in 2020, we saw just over 500,000 deaths from COVID in Europe, and similarly about 540,000 deaths from COVID in the US. Now, every death from illness is a tragic loss, but the comparison just shows us the scale of the problem in Africa if we've lost almost 500,000 children in 2020 from malaria, a disease that is fully curable, a disease that we can eradicate, a disease where we have the tools to win the war. And so we really want to call on our leaders, on government, on the donors to continue sustained funding for malaria. This is something we can definitely eradicate in a generation.
And speaking of, why then are we not winning this battle if 500,000 children in Sub-Saharan Africa, that's 500,000 children, are still losing their lives? And which of those countries are most affected?
Sakina, the top countries affected by malaria in Sub-Saharan Africa are Nigeria, Uganda, Tanzania, and our neighbor Mozambique, and that's where we do a lot of our work. But I think that a lack of resource is one of the biggest challenges to our governments. Malaria has always been a disease of the poor. It never has had the investment that we've now seen, for example, with the onset of the pandemic, of the investment gone into COVID. So we're calling for continued innovation. We know that it takes the public-private partnerships to really spur progress and spur the speed of progress against malaria. And so we're looking for these sustained funding. We're looking for continued innovation. The trick to keep ahead of malaria is to keep innovating. As with COVID, we've seen that the parasite mutates, and that mutation has really been the reason why we've only just recently seen a vaccine for malaria being approved. But we also know that the mosquito does the same. It mutates. So what we've seen is insecticides that have worked against the mosquito in the past today are ineffective. So we're really calling on this continued innovation to get us there. One of the most important elements of success is real-time data. And we've never really had that in the world of malaria. And sadly, this World Malaria Report highlights that, right? So we got the World Malaria Report in the end of November that relates to 2020. We should be having real-time data. And part of what the pandemic has brought, if one can say there's been some good from it, is that it now allows us to have real-time data. Earlier, you mentioned what was the number of cases of COVID yesterday. Why don't we have the same for malaria? Why do we not have that same real-time data? And so that's part of what all the malaria community and the partners to the community need to work on to ensure that surveillance increases, and then we can tackle the disease on a real-time basis.
Yeah, and I suppose you kind of gave the answer to that question when you were speaking earlier, when you said this is a poor man's disease, and therefore perhaps the world not really too focused on what's happening with malaria. But also in South Africa, Sherwin, how are we doing? The incidence of contracting malaria in South Africa, and where in our country, if we use this platform for educational purposes right now, are you likely to find, incidents of malaria in South Africa?
I'm happy to say that malaria certainly is a priority to our Department of Health. Both the minister as well as the DG have given their support to us and have really continued their investment in malaria and are optimistic that they will meet the targets that they've set themselves for malaria elimination in the next few years. And so together we're working to devise a plan and to support government in their goals. With regard to South Africa, we've seen malaria in Limpopo, in Mpumalanga, and in northern KZN. Most prominently on the eastern parts of those provinces, up along the borders with our neighbors. And part of the challenge for South Africa is that we have imported cases of malaria, cases coming across the border. And so part of what Goodbye Malaria is doing is looking to reduce the incidence of malaria from the sources that we know bring the imported cases to South Africa. So, for example, the provinces of Maputo, Gaza, and Inhambane in Mozambique is where we see most of the imported cases coming into South Africa from. And so we work in those areas to try and reduce the prevalence of the disease in those areas, and we get less imported cases in South Africa. And we've seen that working successfully. But being this time of year, which is the time when malaria transmission is at its highest, we would like to ask travelers into those endemic areas to please take precautions. Take a prophylaxis if you are going into Mozambique or you're going into an area where you know there's a high incidence of malaria. The prophylaxis works incredibly well. There's not many side effects as there was in the past, but also simple rules. Apply an insect repellent, one that'll keep the mosquitoes away from you. At dusk and at dawn, wear long sleeve clothing. I know it's hot and it's summer, but wearing long sleeves helps put a barrier between you and the mosquito and helps ensure that you stay safe from malaria. People please need to know that if they have a high temperature after having visited an endemic area, they ask the doctor to please do a malaria test. It's quick. Within a few minutes, you'll have the results, but just be careful and make sure you do check for malaria and not just think the symptoms are similar to COVID and therefore you need to isolate.
Sherwin, thank you so much for your time this morning. And the annual 2021 Malaria Report has been released by the World Health Organization with unfortunate insights showing that malaria cases and deaths have increased for the first time since the year 2000, with Africa's children, the children of Sub-Saharan Africa in particular, under the age of 5 years old, most affected. And you heard there from Sherwin Charles of Goodbye Malaria saying that we've lost as many as 500,000 lives to malaria, and that is absolutely tragic.